Thank you for staying with us, and we'll talk about still about the state of the nation right now, but the state of our economy, some interventions from the government, and a report, from one of the Bretton Woods institutions, the World Bank, where they gave a report and raised concerns over the inefficiency of Nigeria's social safety net programs, revealing that despite more than half of the beneficiaries being poor, the majority of the country's poor population remains unreached. In his latest report titled The State of Social Safety Net in Nigeria, the Global Financial Institution disclosed that 56% of beneficiaries of government safety net programs are poor, yet only 44% of the total benefits actually reach poor households. And according to the World Bank, the disparity highlights a significant inequality in benefit distribution, suggesting that Nigeria's current safety net architecture, though expansive in design, fails to adequately target and sustain its most vulnerable populations. And quoting that report, while 56% of the beneficiaries are poor, only 44% of the total safety nets go to the poor. The share of benefits going to the poor is lower than the share of beneficiaries that are poor. They talk about the inefficiencies stemming from the allocation of benefits. The bank explained that these inefficiencies stems largely from the structure of benefit allocation, which in most cases is determined at the household level rather than on an individual basis. And, the pointed out the National Homegrown School Feeding Program as an example of an initiative that targets individuals directly and could mitigate such inefficiencies. However, it noted that that particular scheme has a limited scope, targeting only children in grades 1 to 3 and restricting its impact. We look into some of these. What's the percentage of these intervention actually? Does it get to the target audience? Actually, if it gets to the target audience, is it making impact? Significant impact on them? Actually, now on the policy, when some of these things are done based on household, if it's done based on household, does it have significant impact? If it's done based on individual, does it have the desired impact? So that it doesn't look like we are just wasting money. And instead of poverty alleviation, some are saying it's just poverty maintenance, not even reduction. We have with us at this time a youth advocate and, of course, a public affairs analyst, Mr. Tunde Omole, joins us virtually. Mr. Omole, good morning. Thank you for joining us.
Good morning. It's good to be here this morning again. Yeah. How are you doing, Femi?
Thank you. Very well. And the World Bank has come out with this report again and said, yes, you are having intervention, but these and these and these are our concern. It's not reaching the target audience and it's not taking away that or reducing that poverty line. Do you agree with this assertion from the World Bank, this report?
Definitely, because when you look critically at the outcome, because most at times in this part of the world, we realize that we measure our success by inputs. And it's an anomaly when you keep measuring your success rates or whatever you have put in effort into based on the effort you have put into it, not mind the fact that success are only measured by an outcome and impact. And when you look critically at most of the indicators or the index that we look at to actually say that a particular program has actually made the much needed difference, then you realize that we are nowhere to be found despite the huge investments. Most importantly, most one that are coming from donor agency or the one that are borrowed to actually service the poverty reduction in the country.
All right, now, Mr. Omole, while the report notes that while 56% of Nigeria's social safety net beneficiaries are poor, they receive only 44% of the total benefits. Now, the point is, this is a striking gap. Do you think that it is a flaw in design, program design, or it is a flaw in delivery? Is that the program that has the flaw, or it's the delivery?
We can't separate the two. when you look at most of in that report, it was asserted that over 60% of the resources being used for safety net program or safety net poverty reduction programs, they are actually donor-funded projects. They are organization development support projects. They are from foreign donors, and most of them, they are actually borrowed. And when you look at that, you realize that most times too, the donors are not being sincere, because when they give you resources, they tend to tailor their expectation towards a particular area, which at the end of the day will not actually go well with us, because we have our peculiarity. What happened in Bangladesh might not actually necessarily happen here. Their strategy you use to reduce reduction in Bangladesh, or you use in India, or you use in Myanmar, might not be the same way you are going to approach it. So the high-handedness and not even giving us free hands to actually utilize resources at our disposal is actually part of the challenges we have. And at the same time, you look at the area of local resources. Most at times, you realize that governments are not planning to have their own resources to support their safety nets. And how will you be depending? What if there is donor gap? If there is funding gap at any time? And we are going through all these challenges in so many areas now. Since Trump policy actually affected most of the donor agencies like USAID, you realize that we are not really accessing funds the way we are supposed to have it. And this is taking a toll on so many outcomes we are having in terms of program intervention, be it social safety nets and whatever we're talking about. And at the same time, you can't rule out the issue of planning, extensive plan, because any result you want to get actually starts from result-oriented planning. And planning doesn't just mean you are planning. You have to put in all the right elements, people that are going to be involved, who are the guests you are putting in place. The people you are doing intervention for, are they actively involved in the planning process? Are they actually involved in decision making? Do you actually, most times you rely solely on the statistics, because we don't have good database. We don't have database that we can explore that will put up the reflection of what is happening in our community. Because it's either we put in settlement while we are collecting data, is that religious settlement comes in, is that cultural, is that population, is that ethnic comes in. So most often we don't have the true reflection of the challenges we are having on ground based on empirical evidence and fact. And if you don't have empirical evidence and fact to plan with, definitely in implementation we not go the way you are expecting it to go. At the same time, you can't rule out the issue around corruption. Most of the funding they are being paid even by corrupt elements that are saddled with the responsibility of ensuring that resources, that money, that investment put in place are actually getting to the target audience. So as you can see, the challenges are hydra-headed. And in as much that we are putting in at planning, we are putting in at so many other things, a lot of factors, Nigerian factors, mentality factor, corruption, and everything. We then, from the planning, you realize that where you are supposed to put round peg in the round hole, you decide because somebody knows somebody, and you put somebody that cannot even put in all their efforts and get the desired result in a place because you know that person. So this has been a bane of us attaining where we are supposed to be in terms of development and poverty reduction as regards the social safety net programs.
All right. When you were speaking earlier, you were making reference to some things that may work out in other countries, making reference to India. Well, in Kenya, in Indonesia, they have the system of open beneficiary register. They also have a form of open payment audit, to keep abreast of all of these beneficiaries, and then to make sure that the intervention meant for this household or this person goes to each person.
Yeah, transparency.
Now, in a situation, in our own institutional environments like Nigeria, do you not think that could be something that will work out here? Just to have a balanced register, an up-to-date register, where we know the number of people who are actually disadvantaged, the number of people who have been helped so far, or those who need further help, so that we can have an accountability and transparent system.
I'm aware that we actually have the social safety nets register. About 80 million people are on that register, and by estimates now, if we extrapolate Nigerian population census of 2006, I think our population is going to about 230 million, over 200 million now. And when you have the register, the essence of that register is for you to be able to capture those people that are actually very, very vulnerable and that are living below poverty line, according to the definition of the imperial world. But nevertheless, it's another thing for you to have register. It is another thing to know who are those people that are even captured in the register. Who are those people that are actually implementing the register? Is the register up to date? Are we using it the way we are supposed to use it? See, in this country, there is no policy that we are supposed to have that we don't have in place. Fine, we know that based on the innovation of technology and so many other things, we really need to be rebranding and come up with new ideas so that it can fit into the prevailing circumstances. But you realize that most of our people don't care. They only think about the immediate. And it's the people that are involved. And when most of these international financing organizations come up with a report at times, fine, it might look like it's the standard for what there might be rots that are much more than, because they are only scratching the surface. I was in one of the higher institutions recently, a federal institution, a federal educational higher institution, and I saw a shopping complex that was built with taxpayer money, all in the middle of the higher institution, all forest grown. We have weed everywhere, and nobody was utilizing that place. Instead, they went to build a makeshift place to actually give to those people that are selling stuff on top. And when I asked, I made inquiry, what's actually going on? Somebody told me that, it's a federal government thing now. So it's until they give order or they give whatever that they can actually do anything about it. And that facility, government must have invested millions into it. And it's getting so it does to speak about our peculiarity as a nation, as followers, as leaders. So at times you can have the register. Is it up to date? Are they using it accordingly? Who are the people that were captured? Who are the data collectors that were used? Was settlements not called into place? Are we not saying that we don't know what this register will turn out to be? Oh, yeah, go and bring even somebody that is not even living below that poverty line. In as much as I'm not taking away the integrity of that data they just told us they have, but is it being used appropriately?
All right. Now, so many questions are being raised here. You start from the place of, the source of this fund, actually, these interventions, that many of them are donor funded. And you say some of these donors, they tell you how to go about it, using a particular standard that might not possibly work in Nigeria, because if it has worked using those countries that you mentioned, Bangladesh, Yemen, in India, in Syria, that doesn't mean that's a reality. So when they give you money and they tell you how to go about it, maybe it's a proven research supported kind of instruction. All we need to do is follow it according to the dictate. But the thing is, will the people in charge follow it? Even on the surface, we've seen situations where food items, stationary items that you have clearly written not to be sold, you find it in shelves, you find it in market. There was a situation, I think years ago, which I know of, in which these dates, they call dabino around here, was brought from Saudi Arabia. Saudi government given to the IDPs to say for Salah, during fasting, to say let's contribute something it was brought there fresh. Less than 2 weeks, those things were not found, only to be found in markets, you know, because, and so donors, they will always say, do it according to this particular way, but there is something, you know, within the system that makes sure these things doesn't, you know, go the way it has been planned. That's on one side. Another situation is this: they are saying 56, you know, percent of these persons, targeted persons, you know, they are still poor, and for only 44% of this intervention get to the targeted audience. Now, number one question is this: let's start from the beginning. This social register that have been talked about, how is it collated? That's the first question. I remember during COVID, Mr. Tunde, in 2020, when Sadia Umar Farouk was the Minister of Humanitarian Affairs and Disaster Management, we were told that children that are home have been fed. You remember? Children are in their parents' home. Okay. Later, we saw distribution of cash on a table in Abuja. Until now, what we've heard of that ministry is the fact that, oh, there are corruption cases against Umar Sadia. After Sadia left, it was better I do. Till now, nothing on better I do. And some are saying when these Bretton Woods institutions like the World Bank come out with this report, some say they intentionally make it so to make it look like Nigeria is not, they can't handle their business, or sometimes they bring it to spite us. And some will say, is it because they want to spite us? We have cases on our hands, especially from that ministry, that have not been resolved till now. My question is this: don't you think that maybe these reports are supposed to be, you know, vetted, so that we just don't take it like that, meaning, oh, it's correct? Or you think this particular one is correct, or there are things we need to take into consideration from the home front ourselves before we question the veracity or the authenticity of this report? If you understand my question.
Now, I want you to put it at the back of your mind that a reputable organization like World Bank will have done a lot of due diligence in getting most of those reports and put it in place. Most of their things, they are research-based and they are scientific proven. But my argument earlier was that most at times, these things are underreported. Even their reports is far off, and how do I put this? It might actually be like they are making it look softer than it looks in reality.
So you think it could be worse?
It could be worse, yes. Because some of us that will work in development space, we relate with people every other day. You know, you have actually pointed out almost everything, all the issues. So I'm not even supposed to complain, to talk about what are the challenges we're having again. You have almost touched everywhere. But nevertheless, you realize that in Nigeria, we don't value most of our local research results. And most of the people, I was having an argument with some of my friends in the academia recently. I told them that with due respect to them, which I have somebody that is very close to me that is part of that community, I said most of the papers you guys churn out, most of the research work that you guys do, I don't think it's having a reflective effect on our development. Because before you guys put up a research for your promotion, you always look for maybe somebody to support you, and maybe you want to use it just for promotion. You are just doing it for academic purpose to be kept in the shelf. I don't think there's any problem we have in Nigeria that people in academic institutions have not done something about. But instead of us having our local research, unbiased research, and compare with the international community, we wait for them to actually put things in place before we can act. Now it is when they put up this thing, and that's why we're having this conversation. Meanwhile, the case is actually worse than we say, because one, they wouldn't want to take anything away from us as a World Bank. They want to help us. They want us to have a true reflection of what's going on in terms of our poverty index, in terms of our human development index. Fine, it's not, they are not always 100% sincere too. You can't take that away from them. But nevertheless, in Jesha land, they will say, any to say be I do, only ke borapa, any to was say atonko. They said somebody that made a soup that is not sweet. We said we should kill that person, that genius should kill that person. What of somebody that didn't make any attempt to actually make a soup for us? So it might not be a true reflection of what's going on. I'm double sure, based on my experience on the field, it's actually worse. But whether we like it or not, at least we have a document to work with. We have an empirical evidence to work with. Then we can do better by actually leveraging that. Then we should put in place, let's start thinking inward. How can we get resources on our own? How can okay, in our own case now, according out of our GDP, we are only spending about 0.14%.
Yeah.
When the average in Africa is about 2 point something and 1.15 or 1.5 in some cases. And we are the giants of Africa. We have the resources. We have the manpower. We have anything you can think of that can make us excel. Then you always find some of our elements that are Nigerians that happens to be a clock in the wheel of progress, right from data collection, right from planning and project designing, right from implementation, a lot of bureaucracies and so many other things. They will come out, they will create a lot of bottleneck, and some use it to score some political points just to make them feel cool. I don't know why, I don't know how they sleep at night. How can somebody go out and say they are paying people they are paying 80 million household almost 50,000 naira every other month? How now, Mr. Femi? Is there anybody close to you? In Ilesha, is there no poor people, vulnerable people in Ilesha? So if a member of your church have gotten 50,000 naira every other month, I'm pretty sure in your church, 2 people must have gotten, or in your province. How many times have you seen anybody that came out and said, I got this also amount of money? So based on this, the World Bank report is a true reflection of what's going on, but they might even be under-reporting based on our experience on the field.
All right. You've really spoken to some of these issues, but then let's talk about, the political prioritization. Is it that, marginalized people, disadvantaged people, are not prioritized, or other fiscal social pressures are really mounted, politically on some of the leaders, such that it's really fizzling out the level of their commitment to the poor in the land, or they're just not really prioritized?
Sorry, I forgot your name again, please.
Temitope.
Temitope, can someone come and meet you during election and give you 10,000 naira and use that to sway your conscience? Because one of the reasons why that might not happen is because to some extent you might not be rich, though I don't know your bank accounts. You might not be rich, but to some extent you are enlightened, you are comfortable to some extent, then you have conscience. You do not belong to the poorest of the poor, so you cannot be easily manipulated. And when I need votes, when I want to be politically relevant, I must be able to give crumbs to those people that are extremely vulnerable and hungry, so that they can see me as demigod, so that they can see me. So when you look at our issues politically, you realize that it favors some set of our population, which are the elites, which are the political player, politically active, politically experienced.
All right. It seems we lost our connection, and I will try to reconnect. And he's raising some very germane points there to say the seemingly poor, very poor, vulnerable state of persons. Okay, go ahead, sir.
So they go on and on